What's going on, guys? This is Dr. Khan, and today we're going to be talking about Nifedipine, Nifedipine, and can these pills cause our ankles and legs to swell up? Let's answer this question. We're going to be talking about its uses as well as 7 common important side effects. So how do these medications work? These are called calcium channel blockers, and basically meaning they inhibit the calcium channel. What these medications do is they prevent the calcium from entering the cell, leading to the muscles of your blood vessels to relax, as well as the muscles of your heart blood vessels to also relax. This leads to opening up of your blood vessels, both in your regular blood as well as around the vessels of your heart. Now this is going to be fairly important because this will lead to the uses of this medication other than just high blood pressure. So now let's talk about the uses other than high blood pressure. Number 1 use is going to be angina, meaning your heart is having pains. That is not a heart attack. That is a very important distinction. Angina pains can happen, but you are not having a heart attack. This can only be judged by your physician. So your physician may prescribe you these medication if you have stable angina, stable heart disease. Also in a type of heart angina called vasospastic, where your vessels are not bad, but your vessels keep on squeezing every now and then. And whenever these vessels squeeze, that leads to you feeling like you are having a heart attack. Your doctor will let you know whether this is a regular heart attack or your blood vessels are just acting up a little bit. They may prescribe you this medication. Next use is going to be high altitude sickness. So basically when people, they ascend onto hills and mountaintops on a very quick pace, they tend to develop swelling and fluid into their lungs. Now this medication has been known to help out with that. So that's why doctors always advise that whenever you want to climb mountains or go on hiking, a little bit slow. Don't go up to the peak of the mountain on your first 1 or 2 days. Stay at the hill station, stay at a certain level for a couple of days before you actually ascend on top of the mountain. Don't be doing that, but this medication may help and your doctor will know what to do. The next use is going to be in pregnant females with high blood pressure. So this medication is generally not considered a first-line medication for regular people, but if you are pregnant and if you have high blood pressure, this medication may be used for you, and this is safe in pregnancy, unlike other high blood pressure medications. Now the last thing I want to talk about is going to be Raynaud's phenomenon. Now this is when your hands and toes actually turn blue and really cold. This could happen if you are in the cold, or you are stressed out or really anxious. So this could happen, and these medications can actually help you out in Raynaud's phenomena if you have it. Now we're going to talk about the side effects of these medications, and these are going to be significant side effects. Now number 1 is going to be it can hurt you in a heart attack situation. If you are having a heart attack, do not be taking these medications. Don't pop these pills. Of course, your doctor will be the person to let you know what you should be taking, because these pills can drop your blood pressure in a certain manner that can lead to your heart rate rising. When your heart rate rises, that means your heart is pumping fast and more aggressively. That leads to an increased demand in your oxygen. Your heart needs more oxygen. But when you're having a heart attack, meaning your blood vessels are really tight and get clogged off, you're not getting any oxygen. When you're not getting oxygen, your heart attack worsens and your heart could have more injury than you would otherwise be having. So don't be taking this medication in case you are having a heart attack, and don't pop any pills unless and until your doctor tells you. So this is very important, guys. Number 2 is going to be syncope or loss of consciousness. These medication can drop your blood pressure to a certain degree, to a certain extent that you lose consciousness. Blood is not flowing into your brain. This could especially happen with the short acting versions of these medication. So most doctors will not prescribe short acting versions to most people. There are certain cases, however. Number 3 is going to be peripheral edema. This basically means swelling of your ankles and your feet and your legs. This could happen in around 4 to 30% of the people, and it all varies, and I'm going to talk about how to prevent this a little later in this video. Now this is very common. It could be very unpleasing to the appearance, but one thing to note over here is that if you have swelling, always let your doctor know, because swelling of your ankles, feet, and legs can also be a sign of fluid accumulating in your legs in heart failure, or when your heart is basically weak, this could be a sign of heart failure, but your doctor will be able to assess whether this is just a side effect of this medication or you are actually going into a bit of heart failure. So keep these things in mind, just to keep some of these things in our mind. Number 4, my friends, is going to be flushing. Your face can flush up, reddish. This could certainly happen. This could happen in up to 25% of the people taking the shorter acting version of this medication, and only in less than 3% of the people with the longer acting version of these medications. So you guys are getting the hint. A short acting version is not the best medication to be taking. Number 5, my friends, is going to be stomach side effects, the gastro side effects. A lot of people can have heartburn. Not a lot, let's say around 10% could have heartburn. Another 11% could actually have nauseousness or nausea. You feel like you're vomiting, and this again happens more in people who are taking the short acting version of this medication, and it is much reduced in the longer acting version of this medication. Number 6 is going to be dizziness and fatigue. Now, dizziness and fatigue could happen in 15 to 30% of the people, especially with the short acting version. Again, the short acting version is the no good version for a lot of people. So this could basically happen when your blood pressure drops too low. You may not test your blood pressure, but your body could be telling you that your blood pressure is low by making you feel dizzy and tired all the time. Number 7 is headache. Yes, up to 16 to 23% of the people may have headache with this. This especially happens when you first start these medication. And in some people, many people actually, if you can wait it out for a couple of days, this headache may resolve. And if your doctor feels that yes, this is an important medication for you, your doctor may continue it. But of course, if any of these side effects are really worrisome or debilitating in any degree for you, then your doctor will probably have to stop this medication and try to find some other solution for you. But headache can go away if you continue it beyond a couple of days. Now, how to reduce these side effects. Number 1 is going to be avoid grapefruit juice. Grapefruit drinking with these medication can lead to increased amount of these medication in your blood. More medication in this blood leading to more side effects. So avoid grapefruit juice when you are taking these types of medications. Next, as we talked about before, try to use the longer acting of these medication. And most doctors in most situations will be providing the longer acting version of these medication. Again, as with most medication, start off with a lower dose because you're not sure how it's going to act for you in the long run. Try to go for lower doses first. Now, the all-important question, when should you be taking these medication? Well, now if you're going to be taking the long-acting version of these pills, which most people should be taking, you need to take this medication on an empty stomach. Empty stomach meaning you should take this medication 1 hour before your meal or at least 2 hours after your meal when your stomach has emptied food into your intestine. Now, when you are not going to be taking these medication at all, and some of this I already mentioned previously, one was of course that you should not take this medication when you are having a heart attack. If you're having chest pains, really bad chest pains, then do not pop this pill thinking that this will relieve your heart attack. Don't do that. Next, very important to know is that if you had stomach problems or stomach surgeries, let's say you had bariatric surgery for obesity, don't take this medication. If you had gastroplasty, don't take this medication. If for some reason your intestine was cut away for some reason, then don't take this medication. What could happen is something called Bezoar, B-E-Z-O-A-R. That is that you may develop a collection of undigested food that may get stuck in your intestine. So this could be like a ball stuck in your intestine. That's no good. Then if your liver is weak, if you have cirrhosis due to any cause, it could be hepatitis, alcohol, anything, this could be dangerous for you if you have liver problems. Anyways, I wanted to cover this very important blood pressure medication group. Let me know where you guys are watching from. Always let me know in the comments below because I love to know where is my audience. And if you really want to work on your blood pressure, I have a detailed course which I call the Blood Pressure Boss course. It will get you the knowledge that you need to correct your blood pressure. It goes over aspects of the physiology of blood pressure as well as natural treatments and supplements and exercises. All of this without medication. And you can start doing this right now and today because it is readily available. And if you are taking medication, it goes over the uses, the most common side effects that you should know about. You have the whole course. So the good thing about this is you have the whole course available to yourselves. You can watch it whenever you want. It is also so economical that everybody can afford it. And it is the same price as a regular dinner outing. Although I feel that the value you will get is truly priceless, it will get you in the mood to fix your blood pressure. That's the real benefit in my opinion. And you will take your health seriously and give yourself the motivation that you need. I also have motivational videos in that course. Thank you so much. Talk to you guys soon.